Circle of Willis. The Circle of Willis is present around the interpeduncular fossa within the subarachnoid space. The Circle of Willis is formed by, first we discussed about location, let's talk about the formation of Circle of Willis now. The Circle of Willis is anteriorly formed by the anterior communicating artery which connects the two anterior cerebral arteries. Anterolaterally we have the anterior cerebral arteries, then laterally we have the internal carotid, posterolaterally we have the posterior communicating artery, and posteriorly we have the posterior cerebral arteries. These are the arterial anastomotic network that are formed in the base of the brain, and these mainly supply the structures in and around the base of the brain. The branches given off from the Circle of Willis include the anteromedial branches which mainly supply the anterior part of the hypothalamus, mainly the preoptic and the supraoptic region. Similarly, the posteromedial branches. The posteromedial branches mainly supply the posterior part of the hypothalamus and also the thalamus. Then, when we talk about anterolateral branches mainly supply the internal capsule. Then we have the posterolateral branches which mainly supply the pulvinar part of the thalamus and also the metathalamus. When we talk about how exactly these blood vessels supply the cerebrum, we will come across three main branches which are called as cortical branches, central branches and choroidal branches. The branches coming from the Circle of Willis are example for central branches because they supply the deeper structures present in the brain. Cortical structures mainly supply the superficial cerebral cortex, whereas the choroidal branches will form the choroid plexus responsible for secretion of CSF. So, all the branches that come from the Circle of Willis are central branches because they supply the deeper structures around the diencephalon and also the internal capsule. This is regarding the branches coming from the Circle of Willis. What is the significance of having Circle of Willis? Circle of Willis is a typical example for collateral circulation that occurs at the base of the brain. The Circle of Willis basically connects the internal carotid arterial system with the vertebrobasilar arterial system. If one of these major arterial system gets occluded, the other part of the arterial system takes over and ensures that the brain will receive adequate amount of blood. Even though it is forming anastomosis, the blood coming from the internal carotid arterial system and the blood coming from the vertebrobasilar system usually does not mix. The exchange of blood only occurs whenever there is a block. Apart from functional significance, the clinical significance of the Circle of Willis is this is more prone for the occurrence of berry aneurysms, right? And rupture of berry aneurysms is one of the most common cause for the subarachnoid hemorrhage. This is in brief regarding Circle of Willis. In the entire topic of blood supply of the brain, this is the one that is very frequently asked in your exam. So